Well, pharmacy automation company IA is moving into its new global headquarters in Indianapolis this week with plans to create more than 400 jobs. IA says it's placing a big bet on Indy's tech sector to power its business through major growth that has been sparked in part by the pandemic. Business of Health reporter KYLIE VELETA is here now with more. KYLIE.
Thank you very much, Gary. IA's national office has been in New York State for about 50 years, but the company needed to shift its base further west to be closer to its customers. The company's proprietary software powers automated systems that can fill almost 250,000 prescriptions per day. IA says taking these prescription filling tasks off pharmacists' plates is more important than ever during the pandemic, and that's driving a boom in business. Here to tell us more about the new global headquarters and how the pandemic is increasing demand for its technology is IA Chief Executive Officer Marvin Richardson. Marvin, thanks for being on the show today.
Thanks, KYLIE, very much for having me.
Let's start with a quick introduction to your company. Tell us just a little bit about IA and how you want to fundamentally change the practice of pharmacy.
Sure, happy to do that. So we're a leading technology provider, and we provide prescription fulfillment solutions, and they're driven by our proprietary software called Symphony. So, we build systems as small as one that would fill 500 prescriptions a day, all the way up to our largest, which is in Charleston for the VA, that's 250,000 a day. So we do that. We're trying to unleash the full potential of pharmacy for our customers. I'm a pharmacist by training. I can tell you that pharmacists today are inundated because they've got paperwork, they've got prescriptions they're filling. On top of that, now they have COVID testing, COVID vaccinations are rolling out across the country, and they need time to patient face. They do not need time to fill prescriptions. Those can be filled centrally in our centralized fulfillment centers. That takes work off of their plate so they can, spend time with patients, which is exactly what they went to school to do.
So you mentioned your company makes some of the hardware, but the really big focus for IA is the software, and that is part of the reason that really led your company to choose Indianapolis for its global headquarters. Can you talk a little bit about that?
Yes. So, Indianapolis was really a natural choice for us. I'm a born and bred Hoosier, but we didn't choose with our heart, we chose with our head. And it's a centralized location for us. It's easier to get to our customers. It's a bigger airport. Working with Governor Holcomb and his team, working with Mayor Hogsett and his team has been incredible. The Indiana economy is vibrant, and we have a great opportunity to build a very vast and diverse pool of talent, particularly in software technology, engineering, pharmacy, and customer service. And we're hiring people into the city. People are moving here, and we're hiring native Hoosiers that live in the Indianapolis area as well. So excited about that. The talent we're seeing so far, and the response we've gotten to the announcement has been incredible.
I think this is really interesting. Your largest client is Publix, which a lot of Hoosiers are familiar with when they head south for vacation. Explain how your technology helped Publix become what you say is the third largest vaccinator in the U.S. right now.
Yeah, it's really incredible. They have 750 locations in the state of Florida, and they are third behind CVS and Walgreens, who have 8,000 each. They're able to do that because they're taking a large percentage of the refills that would normally be done in a retail store, in a public store. Those are being filled centrally in Orlando, Florida. They're trucked back overnight to the store, to the Publix pharmacy, so that the patient can pick them up the next day. That work coming out of the store has enabled them to vaccinate more frequently. They have not added any incremental labor, pharmacy technicians or pharmacists, to that, because they have the time to patient face at Publix today. So it's an incredible success story for them, an incredible success story for us.
Yeah, just a few seconds left. You said they're the best central fill pharmacy model in the U.S., which is also the fastest growing part of your business right now.
It is. Central fill is growing, for the very reason that we've got to take, pharmacist labor out of the store. My daughter's a pharmacist. My daughter-in-law is a pharmacist. I hear their pain points every day. that, it is difficult to find the time to patient face to counsel patients, to vaccinate patients, to test patients when they're feeling, 60 or 70% of the work is in the store that could be removed by one of our central fills.
All right, Marvin. Well, best of luck with the new endeavor. We're out of time. Thanks for being on the show today.
All right. Thanks so much, KYLIE.
And Gary, back to
good
you.
day.
You too.